right. We
So
appear to be live.
if you are joining us, I apologize if you tried the previous link we had. We're on a different one because it's right after a holiday weekend and not everything works perfectly, but we are here. So happy that Lisa Senecal, our founding editor, is joining us today.
Good evening,
I'm Susan
everybody.
Demas, the executive editor here at Lincoln Square, and it was a pretty busy holiday weekend, so I know we have a lot to talk about. And I thought, we would start with the budget bill that Trump signed into law. And if you have tuned in over the weekend, Rick Wilson and Jay Quo talked about it, Joe Trippi on his podcast. We tried to get you covered with all the details. But today I thought we could focus on what might be the first victim of this bill. And that would be the community hospital in McCook, Nebraska. It's a little place just in southwest Nebraska. This is, one of the cornerstones of their community, but this hospital will be closing because of the impending funding cuts, especially on Medicaid. And more than that, this is just supposed to be the first hospital of 6 in Nebraska that are expecting to close soon. And I suspect this will be a trend all over the country, Lisa. I know you're in Vermont in a small town. Let's talk about what these closures could mean for these communities.
Yeah, so many of these rural hospitals, which, by the way, there are more Trump voters served by rural hospitals than there are independent or left leaning voters. So, how devastating this is going to be. And, I can't, there's no schadenfreude. I can't feel at all like, well, you voted for the guy. Because I think still there are so many people who are completely tuned out and they don't understand what this bill that just passed is going to do. There were a lot of people talking about how the Medicaid cuts, aren't going to come into play until after 2026 and in 2027. But that's not the way hospitals plan. So they're looking at the Medicaid cuts that are coming, and they have to budget based on anticipated income and make really hard decisions about whether or not they're going to be able to continue operating. And this first hospital in Nebraska has made that decision, and they haven't made a secret of the fact that it is the Medicaid cuts coming that was the final nail in the coffin that they have to close this place. Um, where I live, the just prior to this bill passing, so I'm not saying this is a result of the bill, just we have a small community hospital where I live, and they are closing down their birthing center, because that's an expensive portion of a hospital to run, but it is very Medicaid dependent overall, this hospital. So what the future of having this hospital at all, um, is, unknown at this point. And absolutely, we're gonna see this rippling across the country. We know the state of our healthcare system. We know how precariously a lot of these small rural hospitals were perched before these Medicaid cuts became law. Um, and I hope everyone is out there beating the drum still. This is the time now to make sure people understand why what is happening because too many of the Republican voters, and even, um, just in general, everybody, uh, they don't realize what is coming for them, and it's gonna be horrific in many different ways, not just Medicaid.
Right. Right. And, we've been hearing from Republicans that, this is just going to affect, losers in their mother's basement, who are living off the government. And, first of all, that's just incredibly degrading. But beyond that, it's just not true. If you have parents or grandparents who are in an assisted living facility, a lot of times Medicaid is a primary funder of that. And so I don't think a lot of us are prepared, for what that might mean for our families, having to have your parents move in or your grandparents move in. um, you know, that's a huge lifestyle change. And even if you're not on Medicaid, uh, hospitals are so dependent on that funding. And that's why you're seeing these closures. And let's not forget that, a lot of hospitals were already facing a lot of crunches. First of all, if you're a small independent hospital in a rural area, probably your margins to operate under are pretty small to begin with. So you really cannot afford this kind of cut from the federal government. But, there's the other factor in that, a lot of private equity firms have been buying up so many of these hospitals because they want to turn a profit. And if it's not going to be profitable, they don't care. They will just close it. And, the effects on everyone in these communities is going to be felt very, very fast because, it's a major employer in so many of these communities. I've been a reporter in so many like small cities where, like up in Saginaw, Michigan or Jackson, Michigan, the hospital is the number one employer. So if you lose that, you lose so many jobs in the community, good paying jobs, that people are dependent on, jobs that people thought would always be secure.
Right.
Um, and, beyond that, just, if you have to, the longer you have to travel to get care, to get emergency care, I mean, those lives are lost in minutes and seconds. You can't afford to be in the back of an ambulance driving for 50 miles if you're having a heart attack. And this is going to just hit everyone. And so it's important that we keep talking about it because um, I really think that the bet that Republicans are making is, oh, you're not going to feel a lot of the big things until after the midterms. People's attention spans will move on. But when your wallet is being hit in so many different ways, your health insurance premiums are going up, your electric bill is going up, I just don't think that people are that detached, that they're just going to say, "Oh, everything's always been terrible," and give Trump a pass. I mean, that's just my take.
Yeah, I think we are already seeing the Trump administration in the horrific things that they're saying about Medicaid recipients, trying to prime, and they did this with, um, Haitian, folks who were here under temporary protected status when they dehumanized them with the idiotic stuff they were saying about eating, people's pets. They're now doing it about Medicaid recipients, right? So if more people start dying and not being able to get the care that they need, the Trump administration is priming people to believe that these were people, if they just would have gotten off the couch and gotten a job and done some work, they could have bought into Obamacare. They could have had private health insurance. They could have had health insurance through their employer, and um, com- forget that this was a huge Trump promise made throughout the campaign that he would not touch Medicaid. He's now gone from, "I'm not gonna touch Medicaid, your Medicaid is safe," to, "If you're on Medicaid, you are a lazy loser, and it is your fault if you
Right.
lose your health insurance,"
And that
because they know people are gonna die.
right. And it's interesting you kind of see this rhetorical split. I mean, Trump, who, let's face it, doesn't really know what's in this bill other than he likes the fact that he now has a private police force to the tune of $175 billion a year with ICE. And he likes the fact that his executive orders are now the law of the land and, no checks on his power. But in terms of Medicaid, he keeps insisting that there aren't cuts in the, in the budget, which we all know there are. But he is banking on the fact that his big MAGA faithful is just going to take his word for it. And meanwhile, you have people like Steve Scalise in Congress who are just saying it only affects illegal immigrants, lazy people. Don't worry about it. It's just waste, fraud, and abuse. And at some point, the rubber hits the road because when you lose your health insurance because you thought that you were on Healthy Michigan, which is our Medicaid program, and you didn't realize that was really Medicaid, then all of a sudden, you understand why this is happening.
Yeah, it's it's incredibly sad for folks who have been working so hard and receiving Medicaid to because the majority of people who are on Medicaid are employed. They are receiving the lowest wages. Um, they work in places that we all go and spend money, and we are also, because of the low wages that they're paid, helping to supply their health insurance. So, a little bit of irony there, but, um, these people don't have the option of working a different job that will earn more money so they don't have to receive Medicaid. Um, we vilified, people who were receiving all different kinds of social benefits, back in the '80s, and, with the welfare queens, stuff that was said, and it was, disgusting and, largely solidified in a lot of Americans' minds that the majority of people receiving Medicaid and other social services are Black Americans because they were an easy target to try to vilify, and the fact has always been and still is that the majority of people who receive social services in this country are white Americans. They are white. So, um, the horrific stereotypes of Black people not being willing to work hard enough to be able to, pull themselves up by their bootstraps and, uh, get off these social services, that was always made to protect white people,
Right.
just was,
You
and
know,
Trump
and we've
loves that.
Yeah. And we've had, a really robust debate in the last, 10, 15 years about the need for more people to have healthcare and health insurance and how far we are lagging other Western democracies on this front who all have some sort of a national healthcare program, whether it's a full on program run by the government or, some sort of, patchwork design more in like Germany. But, the problem of people going bankrupt because they don't have healthcare, that is an American phenomenon, and it's a trend that we really reversed with the passage of the Affordable Care Act during Obama's presidency. And this has been a huge priority for Trump to dismantle Obamacare one way or another. We saw in 2018, he lost that vote because John McCain stood up and he did the thumbs down, and it was an inspiring moment. But that did not stop Trump because he needs to destroy Obama's legacy in every way he can. It's a huge psychological motivator for him. And this bill helps him with that goal. It is the quote unquote skinny repeal of Obamacare. It's not just going after Medicaid. It's going after healthcare on so many fronts, Medicare as well. There are billions of dollars of cuts to Medicare right here in this bill. And so, I think we need to take a moment because, especially with younger voters, one of their big priorities has been everybody should have health care. And that is definitely a goal that, I think so many of us share. And I think it's across the political spectrum. Who doesn't want to have good health care? But now we are going drastically in the other direction. We're not talking about how do we close the gap with the 30 million people who don't have health insurance. We're now going to up that. There will be 50, 60 million people that have health insurance. We're going backwards. And
Well,
so,
and there is a huge focus now, that they there's always the next step when
Mhm.
they accomplish something that they've set out to do that harms the American people. There's always the next thing that they want to do. And if you don't think that they are laser focused on pre existing conditions and getting rid of the ACA's protection that you can't be denied health care, health insurance because you have a pre existing condition, they're coming for that. And you don't people my age and older, probably a little bit younger than I am, remember what life was like when health insurance companies could either, um, determine what your health insurance was going to cost based on a pre-existing condition, and it was so expensive, it meant you couldn't have health insurance,
Right.
or they could just out and out deny you health insurance. So,
Right.
um, and
Yeah.
everything was a pre-existing condition. It was unbelievable what could be listed as a
Right.
pre-existing condition, have
Asthma,
you denied or
pregnancy, just, I mean,
yes. Yes,
pretty much.
pregnancy.
Yes. And everyone has a pre-existing condition one way or another. It'll be interesting. I'm sure COVID will be used as a pre-existing condition, which will be a huge flashpoint with people, I imagine. And it's totally immoral to deny people care if you've had cancer or a heart attack, because the point of insurance is that you are spreading the risk around, because the idea is, look, when you're young and healthy, that is wonderful, but one day all of us will get older, all of us will have health issues, and so as a society we're in this together, and we spread that risk around to make sure that we as a country, we as a people are taken care of. It's just a basic idea, but it goes way beyond that, really. If you have diabetes, if you're pre-diabetic, I mean, these are just millions and millions of us that will be subject to this, and that's why we are going to see our healthcare rates skyrocket, even if we are among those who are not touched by this first round of cuts.
Well,
um
we are because part of what, the ACA did by getting so many more people on insurance was to reduce the number of people who showed up very sick in emergency rooms because they didn't have primary care providers and they weren't getting care regularly, getting annual exams, getting vaccinations that they should be giving. God, there's a whole we can't even get into that this morning. And they were waiting until they or their child was really sick to go to the ER. So by the time they showed up there, they were mm, th- just on a human level, they were much more ill than they ever needed to become. On a financial basis, they were much more expensive to treat than they ever needed to be. It was so many of these things, a scratch that starts to get infected and you go to your primary care doctor and you get on an antibiotic and it's fine. You end up with a major blood infection and you show up at the ER because you got no treatment and this has gone on for weeks. And that's a hospitalization.
right.
And when people can't pay those bills, they get passed on to all of us.
Yes. Right.
And
And
our health insurance rates skyrocket and hospitals who are getting reimbursed close. We're back to the beginning of our conversation.
exactly. Yeah. Because once you take $1 trillion out of the healthcare system, it's a domino effect. And
Yeah, it
so,
is.
we really are watching the dismantling of our healthcare system. And we've seen the dismantling of so many aspects of our society, of our government. I can't help but think of that when I see those tragic floods down in
Yeah.
Texas. They're just horrific. And of course, we can't change acts of God, but we can be better prepared. And we have some of the best, weather scientists in the world that at least used to work for the federal government, for the National Weather Service. But there have been such mass layoffs because of Doge, and you know, I can't help but wonder: is this just the beginning? I mean, we're in hurricane season now, tornado season in much of the Midwest. I'm very concerned that these kinds of tragedies are going to start being the norm and worse than they ever had to be.
Yeah, I think, the last numbers I saw, 82 people are known dead and another 41, I believe, are still missing. It is s beyond imagination what these communities are going through now. And look, it's really fog of war right now, so I don't wanna get in, to blaming the cuts
Right.
yet. It sounds like, there were people who don't work for the National Weather Service who did, who had really important roles, in these kinds of emergencies and in prediction and in getting alerts out to communities. But you're right, Susan. This is only the beginning, and it isn't just, um FEMA and the cuts that they have sustained and whether or not they're going to be there after a disaster, and whether or not we have the predictions being done now that need to be done and the alerts going out that are essential to save lives. Trump has gotten rid of so much of the budget that was dedicated to research. And the the man has no for being, because he had a relative who went to MIT and he thinks somehow by magic and osmosis or something, he is a great scientist, because I don't know, he's an
He's
idiot.
rich,
And
so he's smart.
right. So but he has no appreciation for research. He's doing the same thing at the National Weather Service and NOAA that he has done in the health sector. Cutting out all of these research grants that are absolutely essential in developing the technology that we need to be able to predict earlier and more accurately, because these storms are getting not just more frequent, but so much more severe. This storm in Texas dropped a month's worth of rain in an hour.
Yeah.
The Guadalupe River, when it went over its banks, it rose 25 feet in an hour.
We're
And we
just not prepared for
we're
that.
n we're not prepared, and we're making ourselves more and more unprepared. We know the impacts of climate change are
Right.
going to continue to make these storms so much more severe and more frequent and happening in places that they hadn't happened before. And we're gonna go into this semi-blind,
Yeah.
and, Trump seems okay with that because when you are rich, all of these things that impact middle income and lower income people so severely, you can avoid a lot of the unpleasantness of not having health care and living in areas that get flooded
Mhm.
or living in fire prone areas. You get to avoid a lot of that.
Right.
And if something does happen, short of loss of life, but if you lose property and you're one of Trump's friends, you just build a new property, and
Right.
this is not, an economic devastation for you. But, he has I I hope to God at some point his supporters start putting some of these pieces together and realize what a complete disregard he has for their lives. He does
Mhm.
not care if his supporters live or die. It doesn't matter to him.
Right. But what we've seen is that, even if you are fabulously rich, you're not going to be immune from some of these tragedies. I mean, there is that the horrible story about the camp where, it looks like 20 girls are probably dead. And, that was, not a camp for, not just a day camp. There are a lot of, well-off families that sent their children there. And just like we saw with the pandemic, I mean, there are a lot of Republicans who lost family members, in COVID, and having better scientific policies, better health policies probably could have saved their lives, getting vaccinated, which it should be a no-brainer. I mean, scientific research, this is what it's about. This is why we fund it. This is why our healthcare research is the envy of the world. But it's so important to cut back on government so that you can give billionaires a tax cut, or to follow this kind of blind ideology, and even deny things that could help your own family, and that's personally very, very disturbing to me. Um, and I still have friends who live back in Iowa. That's where I went to school and to college, and I lived there for 10 years, and I can tell you, tornado season is no joke there. I covered a lot of tornadoes during my time as a journalist, and you're really dependent on those warnings. When I was back in college, and in my 20s living in apartments where I did not have a basement. I needed to know exactly what was happening. I lived through 3 different tornadoes. And I'm really, really scared to see what the impact is going to be, because what you were talking about with climate change, back in my old town of Iowa City, they've had like 2 or 3 500-year floods since I've left. That's just the new reality of climate change. And so we are not resilient. Our infrastructure is not resilient enough to withstand this. And so having scientists there on the ground, having people in FEMA who are willing to come in and help and have the funding to do that, that's all the more important. And we just keep breaking down what we're doing to help one another, just the basic building blocks of government and of society. And I feel like that's another goal of Trumpism.
Oh,
This
sure.
this sort of breakdown, and that's very, very sad to me.
Right. This is what authoritarians do, right? They strip away trust in civil society, in experts, and the population becomes sicker, weaker, more dependent, um, and grows to understand that your very survival becomes dependent on your willingness to bend a knee to the authoritarian. And that's the road we're on. There's no it's not hyperbole. We're not making some prediction that may or may not come. This is where we live in the United States. This is what we're living through. And the way that these things end is for people to not wait for the government to come to its senses, or wait for an election to change everything. It takes people speaking up, speaking out, showing up at rallies. Um, the numbers matter. It does still matter to contact members of Congress, because they need to be held accountable all the time for the things that people are seeing happen around this country.
Right.
These disasters need to be hung around the necks of the people who are voting to support Trump's policies and his cuts. So I hope everyone, I know this bill passing last week was really tough. And it- it's not the end. It's not the end. We don't have to live like this. We have not always lived like this. In very recent memory, we didn't live like this, and there is
Mhm.
no reason that we can't turn things around and have the country again that we want, that was never perfect, but
Right.
we were working toward it. We weren't going wildly backwards the way we are now.
Right.
And that's this is up to us.
Right.
So get involved, stay involved. Um, don't be afraid. It is what they count on.
Mhm.
It's how authoritarians win is for the populace to become too afraid to speak up. And we can determine how long this all lasts and how
Right.
quickly we come back from it. And that's on all of us.
Yeah. And look, I'm gonna be honest, it was not the most enjoyable July 4th weekend, and I love Independence Day, you know? I think it's a great time to remember what we love about this country and to take a little break from things with friends and family. But just like last year with the Supreme Court decision on immunity, paving the way for Trump to come back to the White House, this was another pretty sober holiday, as with Trump up there signing his budget bill. And it's okay for us to acknowledge that, this is painful and this is a big setback. But, we are not done yet. There are big
Mhm.
protests that are planned on July 17th. And I know that, so many of us at Lincoln Square, at the Lincoln Project, we're going to be right back there like we were standing with you at the No Kings protests. Um, Letting your elected officials know that you're still watching what they do, that you are going to hold them accountable for what they just voted for. Um, all the parts that they didn't even bother to read because they have such contempt for us. They want us to be defeated. They want us to be depressed. They want us to give up. They want us to feel like there's nothing that we can do. And, we are the United States of America. We have been here for almost 250 years. We have not had a king in this country since then. And the fact that, they're counting us to just roll over and, let the billionaires run this country, let their private police force enforce everything. That's not what this country is about. There are more of us
It's
than there
not
are
what
of them.
Americans do.
No.
It's not what we
And,
do.
we still have all of our rights and we are going to put them to good use.
Yep, absolutely, and we will be right out there with you,
Yeah,
folks, and can't thank you enough for being here with us now.
absolutely.
Um,
Absolutely. And, we're really looking forward to you staying with us this week on Lincoln Square, especially this afternoon. I hope that you will come back. We have a great, great discussion between Bobby Jones, who is the host of Anchor Watch. He's a retired Navy commander. He's talking with Tim Mack, who is right live from Ukraine about the latest there and about Trump's foreign policy as a whole. Because, yes, we bombed Iran and now we're not hearing anything about that anymore. He's just declared victory, even though it's questionable how much of a victory that really was. But those conversations with an expert like Bobby and one of the journalists out there who is really putting it all on the line. Um, I'm really proud that we can offer that on Lincoln Square.
yeah, we can't forget about Ukraine. They are still the front line, the fight, for democracy in Europe. So, and I'm sure they'll get into this later, but, has Trump and Hegseth have frozen, uh, some military shipments that were supposed to have gone to Ukraine. They're doing this stuff quietly,
Mhm.
but if anyone thinks that Trump is not still firmly in Putin's pocket, you're kidding yourselves. He's still going to do what he can to end up having Russia win that war, and we can't have it.
Right. I'm also really excited that, in just an hour and a half at 11, I'll be talking with Mari Manoogian, who heads up the Next 50. And this is a group that focuses on young leaders in the Democratic Party, which I think is something we all know that has to happen. And the Next 50 is looking for the next 50 years, because right now we have to lay the groundwork to have effective leaders of the future. I think we all know the dangers of people who are kind of caught in the past, who don't understand the moment that we're in, that, Trump really is pushing an autocracy and the old rules, the old fighting tactics don't apply anymore. And so it's great to talk with someone who is trying to recruit and promote, leaders who are younger and wanna get involved. I think that's a great thing for all of us.
Yeah, I can only improve things the more we get more young voices, um, out there speaking for us and also electing them.
Right. And don't miss later on in the week, we always end on Fridays with Rick Wilson and his son Andrew. They come and they break down all the data. There's so much of it flying around, and it's just great to have, a program that, will go through what the numbers really mean and how we can use them effectively. And so, stay tuned because they had great numbers last week on just how unpopular the big beautiful bill was. Also looking at how Trump is trying to rebound with his so-called alligator Alcatraz, revving up the base. So really, when you want to know what's going on, where people are at, and how we can start to move people more in the democracy direction, it's just a great little tutorial there, it's just a half hour, and you will come out of it so much smarter.
Yeah, and you come out of it, understanding that no matter what Trump says, he does not have the numbers. The numbers of the American people are not with him on his overall policy or his individual policies, and he becomes more and more unpopular all the time, and it is such a huge advantage for pro-democracy forces in the United States if we will seize it. So I encourage everybody to.
Yeah. And, please come back later on in this week. Tomorrow, Lisa will be talking with Andrew Watkins, as she does every week, looking at Christian nationalism and how Project 2025 is impacting our lives. She will also be talking with David Pepper on Thursdays. They'll break down what's going on in his home state of Ohio, which is a place where MAGA loves to implement their latest horror show, oftentimes before it comes to Washington and beyond. David also has a new book that we should mention, and you should definitely pick that up. Go back and look at Lisa's last interview with David. We've got all the details on how you can get his book.
Yep, it's called
Um,
Saving Democracy. It is the subhead is a manual for saving democracy. So, um, get your hands on it. He has very practical steps for what we can be doing to actively be pushing back on the Trump administration, and it's inspiring. It's a wonderful read that you will come away feeling better and more powerful. So you can get the book in all the usual places, and I hate to even say the place that people think of first to get books, but you can get it there too. Um, and,
but check
it
your independent bookstore too.
Yes, check your independent bookstores, and if they don't have it, ask them to get it. If you borrow from the library and they don't have it, ask them to get it, because they will do that if people from the public come in and say, "Hey, why don't you have David Pepper's Saving Democracy? Seems like a good book to have right now."
Seems like a very good book to have right now. Thank you, Lisa. I appreciate you being here on a Monday morning after the holiday, and thank you all of you for tuning in. I know it may have been slightly difficult to find us this morning, but we're so glad that you're here. Thank
No.
you.
Thanks. Thanks, Susan. Always great to talk with you. Great to see everybody. Thanks for being here.